we were faced with, like any dental practice, we had to come up with guidelines and a plan to survive last year. We had to stop providing in-person care. There were big concerns like staff and patient safety. With new distancing guidelines in place, we had to figure out how to provide dental or oral care to our patients.
When the COVID-19 pandemic of 2020 arrived, in-person oral health care shut down almost completely. This is a story of a response to the shutdown, a response that is still transforming oral health care today.
My name is Shireen Khan. I am the dental director here at the Dimock Center. The Dimock Center is a health center in the heart of Roxbury. So I started working at the Dimock Center in 2016 as a general dentist. 2019, I took over as the dental director, and a year into my leadership, we were faced with the pandemic last year. Unprecedented times, I would say.
Dental clinics needed a way to be able to, one, have some sort of financial sustainability, be able to recover, but also stay in connection with their patients and their team. And so what we did was sit down with C3 to try to help them understand how they can navigate what was going on with COVID-19.
We really pivoted and said, there is a widespread crisis here. And what we need to do is be responsive to that crisis and understand what our health centers need most right now and where we can support those needs.
So we developed a plan that would not only help them survive what was going on at the time, but come out of it better and be more of a leader in oral health and be able to take dentistry into the next level.
This plan became known as the Community Oral Health Transformation, or COrHT Initiative. It started a transformation in oral health care called the 3-Domain Framework.
We developed the 3-Domain Framework through that structure, provided funding to purchase teledentistry equipment. Most of the clinics did not have that. And that gave them the mechanism right away to be able to offer those services and stay in connection with the patients while they weren't able to come into the dental clinic.
And so we immediately started to work on provisioning PCPs, primary care providers, and other clinicians at the health center with the equipment that they needed to provide telehealth services to patients, both from their office setting and from their home.
So we initially thought teledentistry would be temporary. Over the last many months of COVID, we have realized that teledentistry can be utilized not just as a tool to see what is wrong, but to understand, possibly diagnose, and help our patients redirect them to appropriate care.
The other mechanism that we put in place was minimally invasive care, which decreases aerosol.
When we looked back at minimally invasive dentistry as an alternative to aerosol generating procedures, utilizing tools that had been around but were seldom used in practice was, I think, key to surviving this past year. The caries risk assessment tool was one of those. We had heavily relied in pediatrics for the caries risk assessment tool, but during the pandemic, we realized that we had to, based on risk assessment of our patients, provide treatment appropriately. And we've carried that on as we function through the pandemic. So now all our patients receive a caries risk assessment at their exam visits. Oral health is critical for general health. Having the luxury of being within the same site as our medical facility definitely helps with our integrated care model. Dental patients needed a COVID test prior to their dental visit. We would redirect them to our Dimock COVID testing site. When they would show up for their appointments, they realized that there was this easily accessible COVID testing site available. And so that's one example of an integrated model.
The COrHT Initiative was spread through a learning community of federally qualified health centers, FQHCs, to learn, share experiences, and arise from the pandemic stronger.
The COrHT Initiative, was really critical because it did a couple of things. It built community, right? So it created this forum for dentistry to come together. And then secondly, sort of brought in through CareQuest sort of the technical expertise. And like a lot of our other telehealth work, there were kind of sort of two tenets there. There was, how do we block and tackle and get people needed dental care during the pandemic? And then how do we take this wisdom that was being offered through COrHT and build it into what we want the new normal to look like?
The way that we ended up really implementing and operationalizing the framework, it was really based on the individual clinics and their feedback. We knew we were moving in the right direction because we saw encounters were taking place when everything was shut down.
It's not over. We have to continue to explore our options to provide the best care for our patients, whether it's through outreach, whether it's through teledentistry, whether it is through minimally invasive care, our tools like caries risk assessment or integrated care model. We need to continue to explore options. We cannot go back. There is no going back. This is the new normal. And so we need to be able to step up and continue to look for ways to provide the best service to our patients.